We go to Laura Windsor with a report on carpal tunnel syndrome.
If you use a keyboard at work, chances are you may be susceptible to carpal tunnel syndrome. We asked Dr. Andrew Wong of Redlands Community Hospital in Redlands to explain this condition of the hand and wrist.
To understand carpal tunnel, you really have to understand the basic anatomy of the hand. There's several nerves that run into the hand and that really power your hand and give you sensation in your hand. One of those big nerves is the median nerve. It runs down the front of your forearm, it runs through your wrist, through the carpal tunnel, which is a tunnel that houses the median nerve as well as some of the tendons to the hand. The median nerve runs through that tunnel into the hand, powers some of the muscles in the hand, and gives you sensation in your thumb, index finger, middle finger, and half of your ring finger. So with time or with different inflammation within the carpal tunnel, you can get pressure on that nerve. With pressure on that nerve prolonged over time, that can actually decrease the amount of vascular blood flow that gets to the nerve. That causes some scarring around the nerve, and over time that can cause diminished nutrition, which gets into the nerve and can cause problems. Early on, patients come in with symptoms of numbness and tingling, which may come and go. Oftentimes they'll get these symptoms at night where they wake up and their fingers are really burning or tingly and they have to shake them out to get them to wake up. As this progresses in an intermediate phase, they may actually start to get weakness of the hand. And in that advanced stage of carpal tunnel, not only is the hand weak, but they may also get some loss of muscle in the hand as well. Workplace exposures and carpal tunnel syndrome. In my medical opinion, I do think that it plays a very big role in developing carpal tunnel syndrome. And I think that's because the position of the wrist and the hand is really the key factor, and inflammation in the wrist is the key factor in causing carpal tunnel syndrome. What we know from studies is that when your wrist is either bent down or extended up, that puts a lot more pressure at the carpal tunnel, and that really starts off this cycle of inflammation and damage to the median nerve. So people who type for a long time, if the wrists are in a poor position, that can cause carpal tunnel symptoms. Or if you have a lot of inflammation around your tendons, that's another thing that can cause carpal tunnel syndrome. A really important thing is to really pay attention to how you're sitting and how you're addressing your workspace. The really proper way to sit is to have your shoulders relaxed. Your elbows should be at about 90 degrees, and you should be able to reach your keyboard with your elbows at about 90 degrees and your wrists approximately straight. And that really takes a lot of the pressure off of your carpal tunnel. Well, the first line of treatment that I always use is a nighttime splint. And what that does is that holds the wrist in neutral position, and so that when you're positioning yourself at night, you don't get your wrist into that position of deep flexion or extension, and you take some of that pressure off the nerve and you let that nerve heal some. So that's always my first line of treatment. Other treatments we can use are oral medications to decrease inflammation. Some studies have shown that vitamin B6 has some limited efficacy in treating carpal tunnel syndrome. And then beyond that, there's injections that you can do into the carpal tunnel. Carpal tunnel surgery is something that a lot of people have anxiety about. But really it's a pretty quick surgery. It takes about 30 to 40 minutes to perform. It's an in and out surgery, so patients come into the surgery center in the morning and they're able to leave it several hours later. There's different ways of performing carpal tunnel release, but really the goal of all those different methods is the same, and that's to take the pressure off of the median nerve and let the nerve recover and regenerate on its own. Patients with mild or moderate carpal tunnel syndrome often will come back and say, that surgery helped me that night. So they may have some soreness from where their incision was, and that's inevitable. But those symptoms of burning, numbness, and tingling, those can often go away very quickly. And so patients are very happy with that aspect of the surgery.
Fortunately for most people who develop carpal tunnel syndrome, proper treatment usually can relieve the pain and numbness and restore normal use of their wrists and hands. For the American Health Journal, I'm Laura Windsor.